Good morning, everybody. Can you hear me? Good morning. Yep. People don't pay attention to me here either. Good morning, everybody. If you'll take your seats, we'll get started. And hopefully there'll be an adequate opportunity for everybody to revisit and reconnect. The nice thing about these meetings is that you get together and you find you run into people that you want to talk with. So everybody's now seated. So we'll begin the workshop. So I'm George Isham, and I'd like to welcome you to this workshop on the collaboration and innovation at the interface of public health and healthcare. As co-chair of the Institute of Medicine's Roundtable on Population Health Improvement, I want to make sure that I extend a warm welcome to everyone here today. Those here with us in the room, our esteemed speakers, and everyone who is joining us by webcast. And I want to make sure that everybody understands that this session, this meeting will be recorded and will be available on the web afterwards for those of you who can't join us today. I want to extend a special welcome as well to a group at the Mayo Clinic who's tuned in and will be attending the meeting remotely. So that is a delightful kind of thing, and want to extend that to other groups in the future as well. So welcome to those from the Mayo Clinic who are tuned in. The workshop will be webcast in its entirety, and we'll take questions and comments from the virtual audience as well as those of you here as time permits. So the Roundtable on Population Health Improvement provides a trusted venue for leaders from the public and private sectors to meet and discuss the leverage points and opportunities arising from changes in the social and political environment for achieving population health, improved population health. Our vision as a roundtable is that of a strong, healthful, and productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes such as improved life expectancy, improved quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require a robust national and community-based policies and dependable resources to achieve it. So one of our major activities as a roundtable is to sponsor a workshop for member stakeholders and the public to discuss issues of importance to improving the nation's health. Today, our workshop will feature presentations and discussions on the collaboration between public health and healthcare, as I already mentioned. And in thinking about this, I went to the most convenient, ready source of wisdom that I can round up, Wikipedia, and thought a little bit about the fact of collaboration is working with others to do a task or to achieve a shared goal, according to Wikipedia. They go on further to say in that little entry that it is more than the intersection of common goals seen in cooperative ventures, but a deep collective determination to reach identical objectives. That's according to Wikipedia. We can take issue with that over the course of the day or agree with it as we choose. But when we think about the intersection between the public health sector and the healthcare delivery sector, I think it's incumbent on us to really reflect upon that deep collective determination to reach a common goal or an identical objective, and what it takes to get there in terms of those barriers and those issues that may or may not make that objective more difficult, whether it's a difference in subcultures or experiences or lack of communication. All those topics are open for exploration as we go through the course of the day. The other observation I'd make about this topic is a personal one. I've been engaged with activity at the IOM for now, looks like almost 25 years or so. And the very issue that brought me into being aware of the IOM was this one, in terms of being invited to a roundtable activity, or a activity of one of the boards that Rose Martinez actually now leads, but was her predecessor, on the issue of collaboration between public and private financing in achieving better health. So this is not a new topic, but hopefully we have new insights and fresh examples to motivate us on to making further progress over the progress we've made in the last several decades anyway. So anyway, I won't take any further time on personal reflection. I won't take time either to introduce individually all the members of the roundtable, but they are seated in the front rows, or they should be. Maybe they're not. Maybe they're scattered more generally through the audience. But their names are provided in your packet, in your meeting materials. And I'd like to mention that the roundtable is continuing to grow. We have added 2 new members actually from fields well outside of the health realm. And as we think about this nature of collaboration that we're going to explore today between public health and healthcare delivery, it needs to be much broader than that if we're to have an effective dialogue in reaching that aim that we have of improved health and the distribution of that through the population. And so those 2 members are Raphael Bostic, Chair of the Governance and Public Health Enterprise at the Saul Price School of Public Health at the University of Southern California, and former Assistant Secretary for Policy Development and Research at the U.S. Department of Housing and Urban Development. And he is here with us this morning. I want to recognize him. If you wouldn't mind standing just for a second. My co-chair, Dave Kindig, and I had the privilege of having dinner with Raphael last night, and we're very excited about the potential that he can bring to this dialogue as a member of the roundtable. So welcome. And then we also have Carl Cohen, who's unfortunately not able to be with us today, but is the Director of Urban Leadership Program and Clinical Professor in the School of Educational Studies at Claremont Graduate University, and a member of the California State Board of Education, and a former superintendent of schools. So we are at least bringing into our conversation people who bring very important perspectives. I'm very excited, and I know Dave is with me, very excited about the potential of what that dialogue can bring to us in terms of learning, again, how to bring together people from across different disciplines in collaborative efforts and other efforts to improve health. Finally, if you have any questions about the meeting arrangements or logistical issues as the day moves on, please talk to our staff at the registration table, or you'll find them around the room wearing the green colored tags. So I want to make sure that everybody all the arrangements are suitable for everybody and we're comfortable in having this conversation. Note that the meeting materials include items given to the staff in advance, and other materials will be posted after the workshop and on the web. So that will be available to you. So now it's my pleasure to introduce Paul Jarris. We are fortunate to have a partner in planning and holding today's workshop, and that is Paul, Executive Director of the Association of State and Territorial Health Officers. The ASTO-supported Primary Care and Public Health Collaborative is hosting this workshop with the Roundtable, and the Planning Committee was chaired by 2 members of the ASTO-supported group, one of whom is also a member of the Roundtable. So without any further ado, Paul, I'll turn the moderation over to you, and welcome. Thank you.
Thank you. Thank you, George. And I want to thank the Roundtable members for the opportunity to co-convene this today and co-sponsor it. there is a lot of overlap and cross-pollination between the Roundtable and the ASTO-supported Primary Care Public Health Collaborative. And just out of curiosity, if you participate in the collaborative, why don't you raise your hand? So there's quite a few folks. Welcome here also. The collaborative began as a result of the March 2012 IOM report, which was called Primary Care and Public Health, Exploring Integration to Improve Population Health. That continues to be a very influential report to this day. But following that report, we looked at it and had a conversation with Reed Tuckson, who many of you know from United, saying, how do we take the support to action? How do we, bring together a group and also bring it closer to the ground a little bit more? How do we get it to the states and local communities? And as a result, in May of 2014, the IOM and ASTO and United Health Foundation convened a group of about 20 different organizations to come together, and these were public health organizations, clinical organizations, primary care, we had academia there, insurers there, to say, how do we create a strategic direction and a collaborative of multiple organizations to promote and move forward on this issue of integration of primary care and public health? And we set out from that point with a strategic map, with a strategic direction, at first a little bit on the global side, improve population health and lower costs. And I think over time in these collaboratives, we all learn what a collaborative can do and can't do. But it was an important lesson. We had about 6 different work groups going on. One was collecting success stories, worked closely with Lloyd in the playbook. Another was looking at the value proposition. What comes out of this collaboration? Is it in fact valuable, and how do we capture that? Another looked at measurement, about how would we measure collaboration, but how do we measure the impact of collaboration on population health? Another looked at resources. How do we either create resources to support this, to support the infrastructure coming together, and or to redirect existing resources so that we have a more integrated environment. And another was on workforce, which was very interesting. We had people from medical as well as public health academia. We had nursing and other professions basically saying, first of all, what do we teach our students about the other field, but also how do we integrate our 2 fields together in training the workforce of the future so they understand both public health and primary care and health care. That group continues to go on. The model was that each of the collaborative in each of these groups was co-chaired by a primary care person and a public health person. So we were modeling along as we went. We got together again in May of 2014 after 2 years to once again look at the strategic map. What have we accomplished? What direction should we set? There was a slight narrowing of the focus, recognizing that it's difficult, and I think the Roundtable goes through these conversations also. Can a collaborative truly impact population health, or what is it about? And of course we want to do that, but it's not a direct relationship. So the work groups have reformed. There is a steering group, it's not called the steering group, there's a planning committee made up of leaders from major organizations in public health and primary care. We have a number of the organizations up here. There's over 60 different organizations engaged right now. The work groups are meeting bi-monthly, the overall collaborative bi-monthly. And it's an exciting process. There's 4 things that I think come out of a collaborative, ideally. One is the individuals who are participating make connections, but also become more informed as they learn what other sectors are doing. So they themselves benefit. The organizations for which they work also can do their work more effectively if they recognize how many other organizations they might possibly be able to line up with who may be doing related work, because we all know that there's so much parallel work going on that we don't know about. A third level is the pairing off of organizations in the collaborative, and it's been very gratifying for us at ASTO to be doing work with many organizations, the AAFP, the AMA, the National Association of Community Health Centers, that otherwise we would not have been doing if we had not been part of this collaborative. And the final, and probably the hardest nut to crack as a collaborative, is their work that the collaborative as a whole takes on, that all the organizations jointly work on. That is challenging. We were able, and there'll be a presentation later on Million Hearts, to involve many of these organizations as advisors to the Million Hearts Collaborative. But again, it is very hard to take 60 organizations and align them around one initiative. It's an aspiration that I don't think we've quite achieved. So anyway, again, it's a real opportunity for us, and we're very grateful to the IOM. to Rose and Alina also for your support in this, and hopefully we'll continue to promote this in partnership with the IOM Roundtable. So, thank you. I'd like to next introduce Dr. Jose Montero and Dr. Julie Wood. Jose is the director of the New Hampshire Division of Public Health, a former ASTO president, and really initiated and launched the work of ASTO around integration of healthcare and public health. So he's been very influential in this field. And Julie Wood from the American Academy of Family Medicine. She is the vice president for health of the public and interprofessional activities at the Academy. And as an Academy member, I'm glad to have you here. So anyway, two of you come up, please, and thank you.
Good morning. I first would like to thank the rest of our planning committee for their work in preparing this workshop, along with Alina. The committee included Terry Allen, John Auerbach, Ron Bialik, Christopher Holliday, Paul Jarris, and Sarah Linda. A list of the planning committee members and their bios are included in your meeting materials, along with bios of all of our distinguished speakers. We chose to organize the day around 4 topics: payment reform, the Million Hearts Initiative, as Paul alluded to,